Good afternoon and welcome to Can Cable 21. My name is Lucy Aquino and I'm the Chief Executive Officer of Hispano Care Inc., a program of Advocate Illinois Masonic Medical Center. And today you're watching a live interactive show. The lines are open. The number's at the bottom of your screen. And for the next 25 minutes, we're going to be discussing Pap Smears and HPV, human papilloma virus. And today with me, I have our special guest, Dr. Marie Cavilla with Advocate Illinois Masonic Medical Center.
Thank you, Lucy.
Thank you, Dr. Cavilla, for being with us today. Dr. Cavilla, I know that you're affiliated with Illinois Masonic Hospital, but you're also the OB-GYN Treatment Center Medical Director. Can you tell us a little bit about that?
Sure. So the OB-GYN Treatment Center is located right by Illinois Masonic. It's our residency clinic for OB-GYN residents, and we have a wide variety of services there. We treat patients that are both OB, low risk and high risk. So we have maternal fetal medicine specialists on site for patients who have high risk pregnancies. We also have a procedure clinic where we practice all sorts of different procedures, whether it be endometrial biopsies or intrauterine device insertions. We see also patients for colposcopy clinic, and that would be patients who have abnormal Pap smears. So we provide a wide variety of services there. We have bilingual staff over there. We have our diabetic educator who's wonderful in terms of following up patients who might have gestational diabetes. We also have behavioral health on site for patients who might have issues with postpartum depression, et cetera, et cetera.
So you're a full service center. It's usually very unusual to find a medical treatment center that has so many services under one roof.
Yep.
And the fact that you're bilingual and bicultural at the same time. That's wonderful to know. I know that Illinois Masonic has actually, for many years, have gone out of the way to make sure they provide these types of services. But what surprises me is that not too many people know about the secret that they have.
Agreed. I think I really love the clinic because we really see such a diversity of patients from all over. So our residents or staff are used to dealing with patients from many different backgrounds and cultures.
That's wonderful to know. I'll keep doing what you're doing there. It's just tremendous, wonderful amount of work that you do.
Thank you.
So, Dr. Cavilla, I know that we're going to talk about cervical cancer, and we know that it's also one of the easiest cancers that can be prevented with regular screenings and follow-ups. And we know that there are tests out there to find it early. So as we talk about HPV and Pap smears, I'd like to start with Pap smears because really that's your first step. So can we talk a little bit about what is the purpose of a Pap smear?
Sure. So we in this country are very lucky to have Pap smears as a way to screen for cervical cancer. Unfortunately, we do not have other screening tests for other types of gynecologic cancers, such as uterine cancer, ovarian cancer, fallopian tube cancer. So really, those are cancers that we tend to find when a patient has symptoms. As opposed to that, the Pap smear gives us a way to prevent. And so what the Pap smear does is we collect a few cells from the cervix, which we look at under the microscope to look for certain abnormalities that can indicate the presence of human papilloma virus, potentially leading to a precancerous condition.
And so how often should you have a Pap smear, and better yet, when should you get your first Pap?
Sure. So that's a great question, and the guidelines for that have changed recently. And your first Pap smear is supposed to be at the age of 21. And in the age group between 21 and 29, the current recommendation is that Pap smears are every 3 years. And at the age of 30 or older, the current recommendations is that patients get a Pap smear and a test for human papilloma virus every 5 years. Now, it's very important that this is a decision that needs to be made with your gynecologic care provider, and the reason for that is that you need to make sure that you're a candidate for spacing out that screening, meaning that a patient who will be getting Pap smears more infrequently should be a patient who does not have a history of abnormal Pap smears in the past and is not immunosuppressed, meaning they do not have HIV, they haven't had an organ transplant, or other reasons to have a weak immune system.
So, Dr. Cavilla, if let's say there's a history of cancer, cervical cancer, whether it's mother, aunts, sisters, should you be able to get, or should you get, Pap smears more often?
That's a good question, and the answer would be no. The reason for that is because cervical cancer, as opposed to other types of gynecologic cancers, is not familial. So it does not come in families because it is related to the presence or absence of human papillomavirus, which is a sexually transmitted virus.
So that's good to know, because when you always hear another cancer, especially when we're talking about breast health or breast cancer, you know, that's usually you're at higher risk for those types of cancer if it's familiar. So talking about, then going back to our Pap smears, what happens with an abnormal Pap smear? So you come in, patient comes in, has her Pap smear, first Pap smear, God forbid, but comes in and it's abnormal. What's the next steps?
So the next step depends on your age. A lot of times, but in a patient that is 25 or older, typically the next step tends to be a colposcopy. And a colposcopy may sound awful, but it's actually a procedure that we do very often in the office. Patients do not require anesthesia. It's a procedure where we use vinegar to look at the cells of the cervix more carefully through an instrument called a colposcope that looks kind of like a microscope. And then we'll go ahead and take biopsies as needed. Then those biopsies are sent over to the pathologist, and then the pathologist will see, are there any abnormalities in the cells, and if there are, how deep are they, so then we can determine what the next step in treatment will be.
Okay. So let's say someone does need a colposcopy. What's the next step after that?
The next step is actually very well prescribed by a series of guidelines put forth by the American Cancer Society, the American Society for Colposcopy and Cervical Cytopathology. So I always like to tell my patients that what the next step is not based on my warm fuzzy feeling that day. It's really based on these algorithms that have been created by after doing a lot of research. And so the next step may involve removing a bigger portion of the cervix, typically called a LEEP procedure, a loop electrosurgical excision procedure, which again is a procedure that in general is also done in the office. And for that procedure we do some local anesthesia. But we don't, no need to jump there. Certainly the great majority of abnormal Pap smears are resolved without even doing a LEEP procedure.
I do want to remind our viewers that our lines are open. If you have any questions for Dr. Gavia, please give us a call. You can reach us at area code 312-738-1060. The number's at the bottom of your screen. Well, Dr. Gavia, you know that talking about Pap smears, I also hear this a lot, and I think I just want to get the right answer, and I think you have the right answer for us today, which is basically that when women turn a particular age, that Pap smears are no longer warranted. True or false?
So relatively true. So current guidelines actually say that a woman after the age of 65 does not need any more Pap smears. And now again, there are certain caveats to that, and that being that the patient must not be immunocompromised, like I said before, but also that the patient needs to have had screening within the last 10 years, meaning that she must have had 3 Pap smears in the past 10 years between 65 and 55, and also that she must not have had abnormalities in her Pap smears in the prior 20 years. So if all those things are true, then that may be true for the patient, but it's very important that this decision be made in conjunction with the gynecologic provider, in part because even if a patient does not need Pap smears anymore, we want to see those patients after the age of 65 because there are multiple different conditions that can present that are not related to human papillomavirus. So we still, want to see our patients annually and do a breast exam and do a gynae exam and see if they have any other issues with the bladder, et cetera, et cetera.
So that doesn't mean that you just stop going to your gynae.
No.
It just means that it is recommended based on the determinations and those outcomes. But obviously, see your gynae once a year. Right.
Yep.
And
same for the younger patients
right.
as well.
Right.
Even if they do not need a Pap smear, there are
Right.
many reasons to
Right.
see the gynae,
Right.
even if you do not need a Pap smear.
And usually tie it in with your annual physical. It's if you can get that on your calendar every year, Same time, around the same time every year, is get it into your calendar and have an annual physical. There's, prevention, which is what we're always talking about.
Indeed.
Dr. Kabia, I know that today there is a lot of discussion about HPV. You see a lot of TV commercials on television, marketing teens, marketing families, marketing parents, and things like that. But what exactly is HPV, and why the big hoopla now? I mean, it's just like everywhere you turn, you see HPV posters and HPV billboards and HPV commercials. And I know that Latino patients, many of our, even our own members with Hispano Care, are constantly asking, why is this so important? Because when I was raised, this wasn't talked about. So why not? And why is my pediatrician insisting that I do this or do that? Can we talk a little bit about that?
Sure. So, human papillomavirus is a sexually transmitted virus that is extremely common. So, if anybody is sexually active, we say that we have about an 80% chance of ever being infected with human papillomavirus during a lifetime if somebody is sexually active. So it's extremely common. So the reason why we talk about it so much now is because we really have realized the link that there is between human papillomavirus and abnormal pap smears, genital warts, and also because fortunately we have found a way, or there are a variety of different ways of preventing human papillomavirus. So right now we currently have a vaccine available. And so that's the reason why we are targeting younger patients, because a vaccination is recommended for both boys and girls between the ages of 9 and 20 to 26 years old. So a lot of patients ask, why is it that it's recommended so early? And the reason why is because we know that that vaccine works best, one, before the patient has been sexually active, but also two, the younger the patient is, the stronger your immune system will react and the more you'll get protection from that vaccination.
I think we need to do further outreach and education on that, especially in our Latino communities.
Yes.
That really need to understand this a little bit better for what it is. And it's not that we're encouraging having relations. It's just avoiding, preventing something that could potentially happen. Excuse me. Dr. Kabia, are these statistics correct that nearly 80 million people, or about 1 in 4, are currently infected in the United States with HPV?
Yeah, so like I mentioned, human papillomavirus is extremely common, and if you're sexually active, odds are you at one point will have it in our lifetime. So about 80% of patients who are sexually active, or rather, if you're sexually active, there's an 80% chance that you will have human papillomavirus in your lifetime.
Wow. And are there symptoms to any of that?
That's a good question. For women, there are no symptoms related to an abnormal pap smear, unless the abnormality is severe, in which case she may experience bleeding in between periods, she may experience some spotting after intercourse, for example. So that is indicative of maybe a very severe abnormality, potentially even a cervical cancer. There are a bunch of different types of human papillomavirus, and one of the big groups of human papillomavirus can lead to genital warts. So that group, what we call a low-risk family of human papillomavirus, can lead to genital warts, and that's something that the patient would certainly see. In men also, human papillomavirus will certainly lead to genital warts, and occasionally it can lead to penile cancer, and we have also seen a rise in oropharyngeal cancer, so cancers of the head and neck basically due to human papillomavirus.
So what types of screenings are there for women, is it still a pap smear or is it something different? And for men, what type of screening?
So there's no screening recommended for men right now. There are no guidelines for example, patients who are at higher risk, and that would be men who have sex with men. Though some providers do recommend anal pap smears for that population, it's still not a widespread recommendation from large medical organizations. But that's a population that potentially may benefit from screening, and the details of that are kind of still being worked out. But largely for men, there is no screening recommended.
So if someone is infected with HPV, what should someone do?
if somebody's infected with HPV, unfortunately right now we do not have a medication to be given to help with the clearance.
Okay.
We hope that that's coming at some point, but it's not available at this time. So things to do to help improve the clearance rate, which typically it takes a couple of years, 2-3 years, for your body to be able to combat the HPV virus. Then things to do would be to not smoke. So we know that smoking will decrease your immune system, and by doing so it can affect your body's ability to fight that virus. And we know that consistent condom use is something that also potentially may help to improve the clearance rate, because then you're not passing the virus back and forth.
Wow. But to know that there is no treatment currently,
Yeah,
it's pretty scary.
So, I mean, fortunately, having an abnormal Pap smear, having a positive human papillomavirus test does not mean the patient will get cervical cancer. The chance of a patient getting cervical cancer who has an abnormal Pap smear is very low. However, that patient needs to get regular follow-up, because it's the patients that do not get regular follow-up, those are the patients that tend to prevent with those cervical cancers.
Wow. I do want to remind our viewers that our lines are open. Should you have any questions for Dr. Gavidia, please give us a call. The number's at the bottom of your screen. I do want to just share this with our viewers as well. If there is any interest for anyone who is looking for an OB-GYN and needs care and would like to take advantage of all the wonderful services at the OB-GYN Treatment Center at Advocate, Illinois Masonic Medical Center, located at 3048 North Wilton Street in Chicago, which is right behind or next to the hospital over in Wellington near Hawstead, or Wellington and Sheffield, right by the L train. They can call and schedule an appointment, or if you want more information, they can call at 773-296-5420. Again, that number is 773-296-5420. And the staff there is entirely bilingual. So this shouldn't be a language issue, regardless of what language, because they're very good about doing all of that.
Yeah.
So, if you can give advice to whether it's our younger viewers or mid-age viewers, what would that be?
So basically, number one, it's very, very important that whether you need a Pap smear or not, that you see your gynecologic provider. And then the second thing is the main things to do to reduce your risk for human papillomavirus would be, one, to get vaccinated before being sexually active, get vaccinated early. Number two, consistent condom use. So condoms can decrease the chance of getting human papillomavirus, but certainly they will not eliminate it, because human papillomavirus is transmitted by skin-to-skin contact. So obviously there's areas that are not covered by a condom. And so you can still get human papillomavirus, but it will reduce your transmission rate. And finally, to reduce the amount of sexual partners that you have, because we know human papillomavirus is very, very common. And so by increasing the amount of sexual partners, we're increasing our rate for getting human papillomavirus.
Absolutely, absolutely. And doctor, do you see in your career, and which I think is, even though you don't look, it's probably been 10 years already? Wow. Doogie Howser, right? Yeah. But I know, okay. So in those 10 years, what's been your experience with this? I mean, do you see numbers going up, going down, or statistically, are they actually going up?
So, now that we have the vaccination available, we expect that we hopefully will see a decrease in the numbers. But that decrease will take some decades. So I'm afraid it's a little bit too soon for us to really see a decrease in the number of abnormal Pap smears. But we have seen in certain studies in other populations where large numbers of patients in other countries have gotten vaccinated, that does pan out, and that increased vaccination will reduce the number of HPV infections. So even though it's not a reality yet, I hope that will be a reality. The more uptake there is of the vaccination in the coming decades.
Right. So I want to remind our viewers too a little bit, again, doctor, it's so interesting to me to find out, and even though I work at Advocate as well, but interesting to find out that the OB-GYN Treatment Center has all these services. So can you tell us again what all those services were?
Sure. So we have quite a few amount of clinics. So we have our clinic for regular OB patients, obstetric patients, pregnant patients. We have our high-risk patient group with a staffed maternal fetal medicine specialist right on site. In addition to that, we have our colposcopy clinic for any patients with Pap smear abnormalities. We do have services available right there for behavioral health, for diabetic educators, and we also have a great program for young moms called Healthy Families for patients under 26 that provides a lot of services. They hook you up with a doula who will follow you up from your pregnancy to the first year postpartum, and it provide free prenatal classes where you really get a lot of great education about everything: breastfeeding, the labor process, baby care, et cetera, et cetera.
And I know the hospital also provides infant CPR classes as well, and newborns, and all kinds of things. I mean, every time I think about what the hospital is doing and the things they're providing for the community, and especially for their patients, it's just incredible the amount of services that they have. But unfortunately, not everybody knows about it, which is a real shame of it all, because there's just so much going on over at the hospital. So, Dr. Gaviria, we know that about 89,000 women in the United States are diagnosed with gynae cancer. While all women are at risk for developing cancers, few will ever develop one. And but every time we turn around, we're hearing about cervical cancer. And it's frightening for a lot of people. So it seems like is it larger than what it really is?
No, what I would say is that the important thing about Pap smears is that patients are not afraid, because fortunately we are lucky with cervical cancer in that we have a way to catch this early. So as long as you get your regular gynae care, it is unlikely that you will be diagnosed with a cervical cancer. We know that at least half of patients that are diagnosed with cervical cancer are patients that have never gotten any screening. So, it's important that you see your gynae provider and that you make decisions based on your medical history in regards to your Pap smear frequency and in regards to the need for a test for human papillomavirus.
Absolutely. Well, Dr. Slavia, our time here goes by so quickly, but I know this is such an interesting topic, and at the same time, it's one that we need to share, not just with the viewers, but anyone that we know. Women, please go for your annuals, get your exams, do your annual physicals, take care of yourselves. Something that's easily preventable, with a very simple test that can be done. So I want to say thank you so much for being on the show today and sharing your knowledge and all of that. And I'm going to start calling you Doogie Howser. But on behalf of my colleagues at Hispano Care, at Advocate, Illinois Masonic Medical Center, our Medical Treatment Center, OB-GYN over at the hospital, Dr. Sevilla, thank you so much for coming out and sharing this such important information.
Thank you.
So my name is Lucy Aquino, and I am the Chief Executive Officer over at Hispano Care, a program of Advocate, Illinois Masonic Medical Center. And today this program is brought to you by CAN Cable 21, your access channel for information, great information, very, very knowledgeable. Great shows coming up. Please stay tuned for more to come your way. Until next time, we'll see you again soon. Have a great evening, everyone.